Well, autism spectrum disorders are really much more common than people realize. So probably about 1% of the population. The CDC has estimated about 1 in 68 individuals might have a autism spectrum disorder. And autism spectrum disorder presents in different forms, for example. So some people say if you've seen one individual with autism, you've seen one individual with autism. So thinking that autism may present in different forms, for example, and that it's relatively common, it's very important, for example, for pediatricians to screen individuals twice before the age of 2 to pick up on developmental lags, for example. So if individuals are having poor eye gaze, for example, or they're not paying attention in classroom settings, for example, or if they're disruptive, they have aggression or self-injury, for example, or they're not interacting well with their peers, for example, then a primary care pediatrician might pick up some of the developmental lags and then refer the child to a specialist who deals with people with autism spectrum disorders. Psychiatrists, neurologists, developmental pediatricians all deal with patients with ASD, but patients sometimes present to different specialties based on the chief complaint. So if kids aren't talking, they may be referred to a speech or language therapist, for example. If a kid is having a seizure, he may be referred to a neurologist. If there are lots of behavioral difficulties, then they may be referred to a child psychiatrist, as an example. But it's important for all medical specialists to think a little bit about autism spectrum disorders and ask screening questions relating to whether or not they have very rigid routines, for example, or they have poor interactions with their peers, or poor eye gaze, or the ability to communicate in different social situations. If there is a lag, to refer the child to a specialist for further evaluation. There are also gold standard diagnostic tests that can be administered. So there are specialized tests that a psychologist or a neuropsychologist might do to give a gold standard diagnosis of an autism spectrum disorder. That's important because in order to have an individual placed in a specialized school for autism spectrum disorder, or to get early intervention services, for example, or to get the appropriate accommodations in a school setting, it's often important to do specialized testing in order for individuals to get all the services that they're entitled to. And one of the keys in autism is early intervention. The earlier we screen for developmental lags, and the earlier we can intervene with behavioral treatments, educational treatments, and medication treatments, the more likely those individuals are going to have a positive developmental trajectory where they may have a better outcome as it relates to their academic performance or their ability, let's say, to live independently. So we want to make the diagnosis early on. We want to get early interventions that change the developmental trajectory, and we want to personalize the treatment based on the underlying target symptoms or the known underlying mechanisms in order to get them into treatments that are going to have the biggest impact for that individual.